Hi, my name is Stephanie, and I am a current nursing student at the University of Michigan. I am going to present a patient to you right now. Patient is a 54-year-old married Caucasian female. Her current occupation is a stay-at-home mom. Patient came in complaining of pounding, rapid heartbeat, and pain in her lower extremities upon walking or exercise. She began noticing the problem concerning her heart in December of 2016. Patient describes the intensity a 9 on a scale of 1 to 10. She notes that the feeling normally lasts about 60 seconds and happens around 3 times a day. Meditating and deep breathing seem to help, while worrying and stressful situations aggravate the problem. Patient describes the problem as feeling as though her heart has stopped beating. Patient began noticing the pain in her legs in July of 2016. With her grandmother having varicose veins in the past, she assumes that is what she has as well. Patient describes the pain in her legs as 7 on a scale of 1 to 10. Walking and exercise cause the most pain. Patient says that elevating her legs and wearing compression socks help to relieve the pain. She claims she can see her veins clearly on her lower extremities. Current vital signs: blood pressure 127/85, heart rate 102 beats per minute, respiratory rate 16 breaths per minute, temperature 37.1 degrees Celsius taken orally. Past medical history: ulcerative colitis in 2000, hypertension, osteopenia, and anxiety. Patient has only had the rubella immunization. No allergies present. Past surgical history: ileostomy and jaw surgery. Patient is on medication for her hypertension and anxiety. She takes 12.5 milligrams of metoprolol 2 times per day orally and 5 milligrams of Ativan once a day orally. Functional assessment: patient denies tobacco and illicit drug use with occasional recreational alcohol consumption. Her exercise regimen ranges from about 3 to 4 times a week for 1 hour. Patient denies any sleeping disorders, claims to receive about 7 to 8 hours of sleep per night, and drinks about 1 to 2 cups of decaf coffee per day. Psychosocial: patient currently lives in Holland, Michigan with her husband and their dog. She says she has many friends and family around her for support. Her 3 children have all moved out, leaving her and her husband to an empty house. Patient's mother, father, 2 sisters, and brother are still living. Patient denies any psychological diagnosis other than anxiety. She mentions that her husband being away and driving at night are her main stressors. Patient relies on meditation, medicine, family, and prayer for coping, but does not regularly attend church. Family history: father has a history of hypertension, high cholesterol, and macular degeneration. He has also recently been diagnosed with colitis. Mother also has a history of hypertension as well as a past cerebral aneurysm. Her eldest sister has a history of kidney stones and anxiety. Her brother has been diagnosed with diverticulitis and depression. Grandmother had a history of varicose veins. Her son has been diagnosed with retinitis pigmentosa, and her eldest daughter has irritable bowel syndrome. Cardiovascular assessment: due to the patient's complaints of a pounding heartbeat, it is important to assess her cardiovascular system. Patient identifies occasional chest pains in the middle of her chest, lasting about 60 seconds at a time. She denies any arm or jaw numbness. No history of heart disease or heart murmurs. Patient complains of a slight decline in exercise tolerance due to fear of feeling her heart pound and becoming more easily fatigued. She does not have any changes in her distress during walking. Patient denies any difficulty lying flat. She mentions feeling heart palpitations, describing them as her heart beating out of her chest. Associated symptoms include hot flashes and dizziness. Patient denies any shortness of breath or coughing. Physical assessment: upon inspection, there were no heaves or lifts in the chest. Upon palpitation, there were no lifts or thrills over the 5 key areas. The 5 key areas are the aortic, pulmonic, Erb's point, tricuspid, and mitral. Patient's API was palpated and present. Heart rate was slightly increased with a murmur present over the aortic area. Peripheral vascular assessment: due to the patient's history of varicose veins and the complaints of pain in her lower extremities, it is important to assess her peripheral vascular system. Patient complains of pain in her legs and calves while walking or exercising. Sitting down and elevating her legs relieves the pain. She does not have any hair loss or edema present. Patient has no history of clots. She notes being able to see her veins and her legs becoming cyanotic. Patient has had no change in diet and has begun wearing compression socks to alleviate the pain. Physical assessment: upon physical assessment, cyanosis is present on the patient's lower extremities. Patient has even hair distribution with no edema or ulcers present. Varicosities are present on both legs. Upon palpitation, patient's legs are warm and tender. Her capillary refill is less than 2 seconds. Pertinent System 1. Given the patient's current heart palpitations, it is important to assess the patient's endocrine system, as this may be a possible cause. According to a recent journal in Circulation, changes in amount of thyroid hormone have been related to a change in heart rate. The pacemaker-related genes of the sinoatrial node are transcriptionally regulated by the thyroid hormone. While it is clear that this is the case, it is not clear how hyperthyroidism predisposes to atrial fibrillation. Given this information, it is important to check the patient's thyroid levels. Pertinent System 2. Given the patient's age of 54, it is important to assess her reproductive system in case she is experiencing menopause. In a recent article by Best Practice and Research Clinical Obstetrics and Gynaecology, menopause has been linked to causing heart palpitations to occur in older women. Palpitations occur frequently in premenopausal women, but usually subside after menopause. Since the patient is reaching an age where menopause is common, it is important to check her reproductive system for signs of menopause that may be causing her palpitations.